For decades, we've been in this massive global fight against HIV and STIs. But right now, the very ground rules of that fight are changing. We're going to walk through a huge strategic shift, all based on new 2025 guidelines from the World Health Organization. And trust me, this isn't just a minor update, it's a whole new playbook. And look, this playbook isn't some nice to have. It's being written out of absolute necessity. It's a direct answer to the one question that is probably keeping global health leaders up at night. How on earth do you win this fight when the money and the people you rely on are stretched thinner than ever? That's the challenge forcing this total reinvention. So let's dive into what that looks like. So where do we even begin? Well, we start right here at a massive crossroads for global health. The old maps just don't work anymore, the old strategies are hitting their limits, and it's time to chart a completely new path forward. This slide really puts the challenge in stark terms. The WHO is calling it an urgent global recalibration. It's like, imagine being told you have to build a taller, stronger building, but you've got half the bricks you used to. That is exactly the dilemma health programs are facing. It means you can't just work harder, you have to work a whole lot smarter. And what does less actually feel like on the front lines? Well, it looks like this. The money from donors is drying up. There just aren't enough doctors and nurses. And at the same time, more and more people need care. It's a perfect storm, creating what the WHO calls major disruptions and forcing everyone to go back to the drawing board. So with all that stacked against us, you might be thinking, wow, this sounds pretty hopeless, right? But that's where this new WHO playbook comes in. It's a strategy that's not designed for the world we wish we had, but for the one we're actually living in. It's a playbook for a new reality. And the new game plan really boils down to 4 powerful ideas. First up, simplify. Cut through the red tape and make it easier for people to get care. 2, integrate. Stop treating diseases in silos. Combine services, because you have to treat the whole person. 3, and this one is huge, empower choice. Give people more options, because care that actually fits into someone's life is care they'll stick with. And finally, number 4, ensure equity. Actively focus on the communities that are so often missed, because an epidemic isn't over for anyone until it's over for everyone. Okay, so what does this all actually look like on the ground? Let's start with one of the most exciting areas, smarter ways to prevent and treat HIV. This is where the big ideas start to become very real. Now, what's so incredible about this slide is just the sheer scale of the change. For years, HIV prevention, what we call PrEP, meant taking a pill every single day. The new WHO recommended option, it's an injection of a drug called lenacapavir, just twice a year. Think about that, from 365 pills to 2 shots. This is a total game changer, not just for convenience, but for making sure people can actually stay on it. That daily pill can be a huge hurdle for so many people. This just removes that barrier. And this focus on choice gets into some of the most personal, deeply human decisions anyone can make. For so long, the advice for mothers with HIV about breastfeeding was, well, it was confusing and often really stigmatizing. But now, the science is crystal clear, and the guidance is too. If a mother is on treatment and her virus is suppressed, she should be supported in her choice to breastfeed. It's about the science, sure, but it's also about dignity. It's about human rights. And the simplification just keeps on coming. Treatment itself is getting easier, moving from 3 drug cocktails down to 2. Those long-acting injectables, they're now an option for treatment too, not just prevention. And for people at risk of TB, which is a huge issue, the preventative therapy is getting shorter and way more convenient. Each of these might seem like a small change, but when you add them all up, it's a massive shift toward making care easier and more effective. And here's the crucial point. This isn't just about finding new medicines, it's about redesigning the entire system of care so it actually fits into people's real, messy, complicated lives, instead of asking people to bend their lives to fit the system. This is where that idea of integration really clicks. I mean, think about it. Instead of making someone go to one clinic for HIV, another across town for their diabetes, and a third for mental health support, the new model says, let's combine them. Let's offer whole person care in one place. It's way more efficient, it gets better results, and it just acknowledges the simple fact that our health is all interconnected. So, how do you make that happen? How do you actually get this integrated care to the people? Well, you do it by moving services out of big central hospitals and into local community clinics. You use something called task sharing, which means a trained community health worker can handle things like HIV testing, freeing up doctors for more complex cases. And then you use digital health, technology, to bridge all the remaining gaps. It's all about one thing: access. Okay, so we've got smarter treatments and a more people-focused system. But the elephant in the room is still there, right? How do we pay for all this, especially with those shrinking budgets? And that brings us to the final and maybe most critical part of the playbook: how to make this fight sustainable. All right, I know this one looks a little technical, but stick with me, because it's basically the secret sauce that makes a modern health system work. Think of it like this. Before, every clinic and hospital's computer system spoke a different language. They couldn't talk to each other. HL7 FHR, it's like a universal translator. It lets them all share information smoothly and securely. It's the digital backbone for a smarter, more efficient system. And when money is tight, and it is, you have to make some incredibly tough choices. The WHO gets that. So they've laid out this clear ethical framework for how to do it. And this isn't about cutting care randomly. It's about being relentlessly strategic, about figuring out which services save the most lives and then doubling down on those. It's about making sure every single dollar counts. So there you have it. That's the new playbook. It's simpler, it's smarter, it's more integrated, and it's built for the tough reality we're in. It's a strategy born from necessity, but it's absolutely packed with innovation. Which leaves us with the ultimate question. Is this it? Is this how we finally end the epidemic for good?